Anupama. Yes, I have the experience of in both government and a private sector, and really I'm passionate about I'm in dental practice or the holistic dentistry, what I'm doing. So we'll come to the topic. Mouth is the mirror of our body. So I want to share my experience before coming to the topic. I really feel very bad about the thing what I'm facing on day-to-day basis in my practice. See, actually, whenever there is scar in our face, we just run to the doctor, skin specialist. Whenever there is like finger pain or like legs pain, hands pain, we just go and ask the doctor to save the organs like finger or hand. We won't say that just remove that, but whenever my patients comes to my clinic, they come in a most of all the people, like 70% of the people, they come with like worst oral hygiene and the bad teeth, and they come and they say remove the teeth. I really feel bad. For other doctors, it might be one body. For gynecologists, it might be one baby. For me, it is 28 or 32 babies in the mouth. So I always feel like too bad to remove the teeth. I want to save the teeth, but the people come at the end stage. So I tell always, why you neglect the mouth? Mouth is inside your body. Why you like not taking care, like however you take care of your body as such. So I want you to, overall, I want to say like now, you concentrate on what I'm telling. Really, I can't tell everything, whatever I know in dentistry, but I can give you a glimpse so that you can take care of your family, your kids, and overall your friends about you can make them knowledgeable about this, my topic, like mouth is the mirror of our body. So as I say, the mouth is a mirror. Why? We can see so many diseases which is there in the body through the mouth. Whenever we examine our mouth, we can see the most of all the diseases which is there. What I'm saying. How? The teeth are connected with our body, different organs through each teeth. Like how through we call it as the meridian, the energy system, and the bloodstream. So whenever there is an infection in the oral cavity or in the teeth, so it can go through, it can enter the pathogens or the infections can enter the bloodstream. And from the bloodstream, the blood travels all over the body, and the pathogens can go and infect any organs in our body. So, but people neglect again each teeth. You can see in the picture what is there shown, like each teeth are interrelated. So the few theses have shown already that few incisors are related to kidney and bladder. The few molars are linked to a liver and gallbladder, and so and so. So gum diseases, when it is infected, the gum, I think you can understand gingiva gum. When it is infected, it can travel through the bloodstream again, like whenever there is infected root canal too. I think people know about root canal. Inside the tooth, there is a canal. We call it as root canal, where the blood vessels and nerve tissues comes and gives energy or uh, life to the tooth. So, when it is infected, it can travel all over the body. Studies have linked the gum diseases is dangerous and increases heart diseases. Whenever the diabetic patients, if it is the gum disease is untreated, then it will cause a disease called subacute bacterial endocarditis, which is nothing but infection of the inner layer of the heart and a valves, which is a dangerous and a silent killer actually. When we come to a kids, a smaller kid, a poor oral hygiene in a kid, it will affect the growth of the particular child, because of he can't able to chew, like he won't be able to chew the food properly, he can't have the nutritious food as such, so his growth will be declined. When you come to a pregnant woman, so I think the most, I mean, in corporate people, I mean, hospitals they follow, but most of all the people they doesn't follow. Before conceiving, they need to check their oral cavity. There should not be any infections. But what happens exactly if there is some infections in the oral cavity, if there is pus, if there is bleeding gums, what happens, like it can cause stillbirth. You all know pregnancy is so precious. Stillbirth means like when babies uh, it will die, it will be dead when it is coming out or when it is like born, I mean giving birth. And there will be underweight babies, there will be abortions, there will be like conceiving only, it will be very difficult when there is oral infections. I think you can understand the importance of it. Whenever there is a major surgeries like cancer surgeries, transplant surgeries, heart surgeries, doctors send people to go to oral surgeons or dental surgeons to get their oral cavity like completely out of infections. So I don't know how many people know about all these things. Now I think understood at least a part of like how much it is very much important. So let me clear, like before going further, few myths, which is like uh, people are like neglecting about their teeth. You need to visit dentist whenever there is a problem. Is it right? Yes or no? You can type actually. If you are active, if you are listening to me, you can type like yes or no. You need to visit your dentist only when you are having problem. See, so many S are coming. So actually the thing is, I'll add on one more thing. You need not worry about milk teeth for the kids, as permanent teeth are anyway it's coming. Actually, no. The thing is, the first visit for anyone who is born is the first day of their birth. Their parents has to bring the kid for a oral checkup. Why? Because the mother that she won't be knowing how to clean the mouth of a baby after feeding. So usually how it is connected, I'll tell you. Around like 1.5 to 2 years, parents bring the kid with like lots of dental caries in the mouth. Except the lower incisors, all other teeth are carious. People say he has eaten something, he eats chocolates, so many things. But the main culprit is mother. So after feeding, usually the before going to the usually babies will go to sleep whenever it's getting fed. After that, the last sip of milk will be there in the mouth, which will affect the teeth, which is erupting, and it will cause dental caries. So we call it as nursing bottle caries. So it's not like when the problem arises, it is at the beginning stage. And routinely, once in 6 months, you need to check your oral cavity because so many things like unnoticed stuff, it will be get identified. However, we go to blood investigation now once in a year. Like other follow-up checkups, you need to go for a dental visit. Actually, you can examine your oral cavity and rest of the things like which you can't observe. You can go to a nearby dental surgeon and get the screening done, which will be very helpful because you can remove the cause at the earlier stage. People say sweets and chocolates are the culprits. No, exactly the thing is, all the food we eat, if it is there in the oral cavity for few hours, the bacteria, anyway, microorganisms will come to eat it, but in the process, it will release a acid that causes demineralization of an enamel. Enamel is the hardest part in our body, harder than the bone. That will get remineralized. Because of that, the cavity will form. This process is not in a minute, not in a seconds, not in a hours. It takes days together to become a cavity. That means we will be neglecting for more than 2 to 6 months before the cavity happens. Okay. So another thing is like most of all the people they say bleeding gums. I have since 1 year. I have since 3 years. Bleeding gums is not the thing which should be neglected because gums are like anyway the bleeding gums or the periodontal tissue what we call surrounding the tooth, it is directly connected to the other organs as side. The heart is the important organ which is connected. So bleeding gums should not be neglected, and it shows bleeding gum shows the underlying the diseases which is there, systemic diseases, nutritional deficiencies too. The next comes the orthodontic treatment, what I've shown in the slide. Orthodontic treatment is correction of the irregular teeth. So usually when they come at around after 12 years. They come for a, if there is proclination or if there is irregularity of the teeth, they come for a correction. See, they come and during the marriage, like whenever they want their kids to get married, that time they bring it. It's very wrong, actually. What happens? For an orthodontic treatment, it's not only for the good look. It is for a confident smile, better smile. There will be like socially, kids will be very like they won't mingle with anybody. The what do you call the social communications between others will be reduced. They'll be like depressed whenever this there won't be there will be an irregular teeth or anterior teeth are caries, so they can't chew better. And to avoid the dental caries and to clean it better, even though even you're brushing, the teeth has to be arranged in a proper way. Okay, so that's why it has to be corrected at the earlier stage. So people say I brush twice daily. Then also why I get caries. The thing is they brush twice daily, but in between they'll be chewing so many things. Like they'll be drinking coffee, they'll be drinking juice, and they'll be munching something. Each time, can they brush? No, but at least they can swish their mouth. So after eating or drinking anything, even after drinking milk, even after drinking juice, you need to swish your mouth. So that is most important. Okay, again we'll come now. Why mouth is the mirror of our body. So I want to say like how what all things we can see in a mouth. Poor nutrition. Whenever there is a person is poor nutrition, whenever there is a deficiency in the mouth, we can see anemia, we can see bleeding gums, we can see mouth ulcers, we can see the loosening of teeth. So whenever patient is having diabetes, okay, we can see dry mouth. We can see loosening of teeth again. We can see bone resorption. People's like teeth are like gums are very less and teeth looks longer. There will be fungal infections in the mouth, and there will be slow healing. Whenever there is a kidney disease, the breath of the person shows whether he is diabetic, whether he is having kidney disease, whether he is having lung diseases. When there is a esophageal reflex, we call it as like gastroesophageal reflex. uh, mm, Patients will be having sensitive teeth. The teeth's inside part will get eroded, and patients will be having sensitive teeth, even though they are not having dental caries. So that when we see that erosion in the mouth, we can identify GARD, that gastrointestinal disease. Whenever there is rheumatoid arthritis, so we can see there is a pain here. TMJ, we call it as temporomandibular joint. So there will be an arthritis of this joint too. Whenever there is pain here, this pain can radiate to the finger too, actually. So which is like again, it's very severe one, which has to be corrected. And whenever there is TMJ pain, again induced because of the very bad stress too. So, and cardiovascular diseases. When we come to cardiovascular disease, there will be periodontitis and a bleeding gums in a patient. We can see a worse disease like HIV and AIDS signs in the oral cavity. We call it as hairy leukoplakia. The tongue looks like hair growth on the tongue. Okay, and we can see cancers like identified in the mouth too. There are so many things like when people are taking so many drugs for a long durations like psychiatric drugs, antipsychotic drugs, and epileptic drug. So all those things are identified like because of that drug induced changes in the mouth. In pregnancy also we can see changes in the mouth. There will be an inflammation. It's not only inflammation, it's enlargement of the gums. And even autoimmune diseases we can identify like Sjogren's syndrome. There will be dry mouth. It's an syndrome is like multiple organs are involved. That also we can identify in a mouth. In a liver disease, we can identify by seeing the mucosa. So there are so many things hidden. We can find out it with a blood investigation. Before blood investigation only, we can see in the mouth what are the diseases which they are like people are suffering. So, why they all these things are like you need to concentrate and you need to know like people who has to um, clear their oral issues. They want their kids to be healthy, which they are suffering now. The kids should not be suffering, and they want to treat their oral health or a body health in a holistic way, in a systematic way. How it is possible? Actually, you have to work on root cause. So as I said, only brushing is not enough. So only flossing is not enough. So the thing is more than that, you need to work on your lifestyle. What is it? Lifestyle. So you all know eating right, it's very important. So you all know junk is very bad. Bad. People say chocolates are very bad. People say bakery items are very bad, but then also they eat. So following a good lifestyle, good balanced diet, so nutritious, fibrous, which is rich in vitamins and minerals and protein, healthy fat. These are the good things which you have to inculcate, and parents has to follow first, and kids will truly follow by seeing you how you are following it. So, lifestyle by balanced diet and a nutritious diet, you have to cut down sugary items and sugars, direct sugars in their food, in your food. So, we need to like, as my slide shows, like six pillars I'm talking about. First, one thing what I told is like balanced food, balanced diet. The one more thing it's added to the diet only like it's hydration. Everybody will think like its body needs water. So we'll be drinking like 8 cups of water or how many liters of water. But do you know it impacts? So I mean impact on the oral cavities also it's very good when you drink more water. What it does, like sipping water regularly, will keep your mouth clean. Your bad microorganisms will get reduced. The colony of microorganisms will get reduced in the mouth. So the disease related to those organisms will reduce. The dry mouth, bad breath will get reduced with by sipping water. So you know hydration it's needed for the body also and your oral cavity also. And you should not forget the oral habit, I mean hygiene habits. You need to brush wisely, morning and night it's mandatory, and flossing is needed wherever people are having food impactions or a food lodgement in between, and swishing your mouth is very much important in all other times in between the day. Yeah. Third one, like it's adds on to the nutrition part is the whenever there is a deficiency, vitamin C, you can see bleeding gums. Vitamin D, you can see like top to bottom from head to toe. Like all the things will get affected, even inside organs and vitamin D deficiency. I have seen in my patients, whoever having loose teeth or bleeding gums, when I check their vitamin D, it will be less. And when their vitamin D is corrected, it will come back to normal with the local irritant removal, added local irritant removal. So vitamin D is very much important. It plays greater role. Vitamin B, you people all know, like whenever there is mouth ulcers, you take like I took B complex. But add on, you need to check other deficiency, and vitamin B also it's very much needed. And for our bone, we need calcium, magnesium, all other minerals for our healthy bones. So exercise. Yes, exercise. Again, everybody feels only for the body, for the muscles. No, whenever you do exercise, the circulation increases in our mouth too. So whenever there is a good circulation, it removes pathogens and healing happens better. So exercise is important. Sleep. When it comes to sleep, the more whoever who has not slept properly, next day their digestive enzymes, which has to secrete in the mouth, which has to secrete in the gut, it won't secrete properly. So when it won't secrete properly, digestion doesn't happen. So even whenever it won't secrete properly, there will be dry mouth. Dry mouth causes again dental caries and periodontal diseases. Come to stress. So in stress, I told you already, like TMJ arthritis. So whenever there is stress, people do there is something called night grinding. They'll be grinding their teeth in the night. You can feel some people they can hear the sounds too. This because of this night grinding, what happens? All the chewing part of the teeth will get grinded, and there will be sensitivity of the teeth. Along with that, there will be TMJ joint will be worn out. Because of that, they'll be having weight pain till the ear, till the like what I told shoulder, till the head. They'll be having. I've seen people with this TMJ arthritis at the age of even like around 12 to 14 years, the people who are taking exams like PU exams, NEET exams too. So stress, the jaw pain, I mean, it's very much related. Even you have stress hormones like cortisons, when it is releases, it causes dry mouth too. So what you people understood about all these things, so you know now what exactly the thing you need to take care of. Everybody knows prevention is better than cure. Whenever there is you need cure, you need to go to a nearby, I mean, you're a doctor, you're a dental surgeon, but when you need prevention, you need to work on this lifestyle habits, lifestyle pillars. So everybody follows few are like one or the other two pillars, but when you follow it in systematic way, truly it helps you. When you clear your oral infections, when you take care of your oral cavity, your overall body will be very healthy. So if you need, like, truly whoever have invited you, you go back to them. If you have any infections in oral cavity, to solve, like, your kids not to like suffer from these things, you please do approach a person who has called you. So thank you for patience listening, and thank you for the opportunity, WQ community. Thank you.